Hello, I'm Mabel Zhang. Thanks for joining me. You're watching the World Healthcare Congress Interview Zone, and so I'm so pleased to have with me Dr. Naomi Fried, who is the Chief Innovation Officer over at Boston Children's Hospital. Dr. Fried, it's great to see you.
Thank you, Mabel. I'm delighted to be here today.
Now, you're very busy at the hospital now. What are you doing to create a more innovative culture there?
Well, I think there's sort of four elements to create an innovation culture within a healthcare organization. We're focusing on all four. The first aspect is sort of recognizing how innovation happens and understanding the innovation life cycle that needs to be followed, and helping particularly innovators understand when they're going to hit the O gap. The second aspect for us in building innovation culture is resourcing the innovators and providing them with support. We have a number of programs to help innovators get started. The third aspect that's really important in building an innovation culture is recognizing that risk and failure is part of innovation, and really creating a welcoming, accepting environment where people aren't punished for their failure, but really where we can see those failures as learning opportunities, and to create a safe environment for innovation. And the fourth aspect that I think is quite important is recognizing and rewarding innovators, because innovation is hard. It doesn't always work out the first time. People have to try over and over again. So it's important to create an atmosphere where you recognize the hard work that innovators are doing.
Well, you mentioned briefly the O gap. I guess that's the period when people's ideas can be stopped short by how things have always been done.
Yes.
How is that affecting innovators today?
So the O gap is that very difficult transition when you've had a successful pilot and you want to broadly operationalize it across an organization. And when innovators aren't aware that there's an O gap and don't prepare for it in advance, it can really be a huge stumbling block. A great idea that's been successful can just die at that point. So I always counsel my innovators to start thinking about the O gap, which occurs in most large organizations, particularly ones with disparate leadership in different places. And if the innovator can actually engage the operationalization folks early in the process, particularly in the ideation and pilot phase, that probably more than anything will help shrink the O gap when they do get to it.
Okay, and what is happening that is unique to Boston Children's right now in the area of innovation?
So we have a number of resources that we're making available to our innovators to really facilitate grassroots innovation. We have a seed fund program called our Innovators program to help people get started and test out new ideas, and we've actually supported 26 projects to date. We also have another, what I think is very unique program called our Fast Track Innovation and Technology, or FIT Award, and this is for innovators who have new ideas for the development of a new piece of software. So they don't apply for an Innovestment Grant Award, they apply for a FIT Award, and what they get when they win a FIT Award is not money, but time with developers who will actually build out a proof of concept or prototype for them. We've done 7 projects to date, some of which have been operationalized already. And it's really an exciting way for people that have an idea to get up and running with it.
What is the fastest period of time you've ever seen from idea to actually having this up and running?
Well, I think every project is different, and it totally depends on the complexity, but I'm very proud of one of our projects that was a FIT project a couple of years ago. We built a pilot to replace the whiteboards that were in use on our floors, and these whiteboards had the patient's name, their room number, the doctor's contact information, and they were really great if you were standing in front of them or if anyone had updated them recently, but they weren't as useful as one would have hoped. So we replaced that with a digital smartboard that in real time pulls information from 4 disparate clinical systems and displays the same information and makes it available throughout the hospital. And so, you know, we built the prototype through the FIT program. It was tested and piloted, and the users loved it. And because we had the operational leadership and folks that were involved in operations involved early in that process, that project zipped through the O gap. And today I'm very pleased to say it's been in operations since last year, broadly deployed across our whole hospital. In every floor now you see the digital smartboard replacing that white grease board.
So it was really important to get the key departments involved early.
Yes.
Can that be applied to other changes in the healthcare landscape now? Can you apply your real life experience and innovation to things that are happening in general in healthcare?
I think it's always important when you're trying new things, piloting projects, to think about what the implications might be at scale. And so I'd encourage anyone who is working on a new idea not just to think about whether that idea is going to be successful, but what it would mean to scale it up and who needs to get involved, and start talking to those folks early on.
Okay, Dr. Fried, it's always a pleasure to see you.
Thank you, Mabel. It's great speaking with you.
Thank you so much. And I'm Mabel Zhang. Thanks for watching.